Hi everyone. So I'll say a few words first of all, and then we'll hand over to Deb Abbott as well from Emergency Management Victoria. So as you may be aware, currently there's 99 active cases of people who have tested positive for COVID-19 in relation to the Shepparton outbreak. That's an increase of 9 on the case numbers that were reported yesterday. There is some variation in relation to the total number from day to day and the number of people that are testing positive each day, because we are transferring patients to Melbourne for higher levels of care. So on that front, I think it's really important for people to understand the Delta variant of the coronavirus is a really nasty virus. We are seeing people coming into our emergency department that are critically unwell, and somewhat surprisingly, their conditions at home are deteriorating really quickly. So from that perspective, again, we're really urging people who have any symptoms of COVID-19, no matter how mild they are, to come forward and be tested straight away. As I mentioned yesterday, it's not only respiratory symptoms that seem to be the case for people who have contracted COVID at the moment. There is some stomach and lower gastrointestinal symptoms as well, people feeling nauseous, vomiting, and sometimes having diarrhea as well. So if you've got those symptoms, don't dismiss them as a normal tummy bug or whatever the case might be. They could well be COVID as well. So please, as soon as you get the symptoms, don't delay, come forward and get tested straight away. We are seeing in the data that is being available so far with the testing that's been undertaken is that on average people are waiting higher than 2 days or more than 2 days from the onset of when they get symptoms. So clearly that's not the situation that we would want to be occurring, because it means that during that period they're infectious, and it means that they're spreading the virus around to probably at this stage mostly in their households, but certainly in and around the community or whatever they might be moving as well. So from that perspective, we just again reinforce that simple message that if you've got symptoms, come forward and get tested straight away. We're also encouraging people from any exposure site that's listed on the department's website to come forward and be tested if you haven't already been tested. We do know that there's still some people who have been to exposure sites that haven't come forward, and of course the areas that we're focusing on at the moment are the Sky Salon hairdressing studio in Vaughan Street in Shepparton, as well as the Sir Ian McLennan Centre in Mooroopna, and the community centre at the Shepparton East Sports Stadium. In relation to vaccination, there is excellent access to vaccination. People can make a booking either online at the coronavirus.vic.gov.au website or by calling 1800 675 398. So those are plenty of appointments here. We're seeing good numbers of people being vaccinated. In the last 2 weeks, we've vaccinated 4,000 people each week at our vaccination hub. There's plenty of access. We are opening more sessions and more times in the evening, and we're also open on Saturdays. So in terms of access to vaccination, there's plenty of opportunities, and of course if you are now eligible, please come forward and get tested straight away. So I'm happy to take some questions.
In terms of people still being out in the community while they're infectious, are we still seeing that happening at the moment?
There are some examples of where people who are infectious are still moving around in the community. Probably not as much as it was in the early part of the pandemic, the outbreak rather, but definitely there still are some examples. And again, it's, don't delay. As soon as you get symptoms, be tested straight away.
How are we going for planning for day 13 testing?
So the day 13 planning is well underway. We think at this stage, so some people have already started to progress through their day 13 testing. All of the numbers are being calculated in terms of what we think are going to be the peak days in the coming days, the rest of this week. And it looks like Thursday and possibly Friday will be the higher days. We expect that there'll be a number of the school sites that are Tier 1 exposure sites that the primary close contacts will need testing on that day. So that's probably most relevant for Notre Dame and the remaining Greater Shepparton College campuses that are still tier 1 exposure sites. But all of the work is well underway. If I just encourage people to rely on the information that's being provided from the Department of Health in terms of when their day 13 test day is, and that could be either a written letter or email, but also a text message as well. So use that information from the Department of Health as your single source of truth in relation to when you need to get a day 13 test. And we'll have plenty of capacity. We're going to move through a system where we'll stagger during the course of the day certain year levels for those big school sites. So and we'll share all of that information just in order to be able to manage the demand. We'll have people at all of the testing sites using apps and other ways to communicate to manage the demand and the queues that might be forming across different sites, so we can spread the load across Shepparton and Mooroopna for testing.
Given we've seen other outbreaks, day 13 testing bring up a lot of cases, are you expecting that will be the fact here as well?
It's quite possible, and that certainly that has been a trend in other outbreaks where people at day 13 have been testing positive. We did make a call over the weekend on Saturday for people who were in the middle or thereabouts in the midpoint of their quarantine period to come forward for some voluntary testing, and that was really to understand if they had contracted COVID during that period, but also for some additional surveillance. I'm not aware there's been any people test positive as a result of that at this stage, but certainly people obviously can't be released from quarantine until they get a negative result. So please pay attention to when your day 13 is, and we're going to manage the demand as best as we can later in the week.
You were saying that a few people had to be transferred out with COVID. What sort of numbers are we talking about there from Shepparton that have gone to? At least six
people. And there's, we've had a small number of people admitted into our wards as well during the course of the last 1 to 2 days, and a number of people requiring care in the emergency department. So, as I mentioned before, it's really a big change from what we experienced last year in Shepparton, is that the people who are contracting the Delta variant are becoming really unwell and becoming unwell quickly. And that's a trend that's observed in Melbourne, but also in New South Wales as well. So ultimately, the only way we're going to beat this is if everybody gets vaccinated and does the right thing on top of being vaccinated, and continues to wear masks, keep your distance, sanitise, all of those things that we have are now part of our day-to-day life. We just can't let them drop away.
The outbreak seems to have been contained over the weekend just to Shepparton. How are we going? Has it spread to any other areas that you know of?
No new spread beyond Shepparton. It is somewhat contained. Yes, that's a reasonable way to describe it, but I wouldn't necessarily describe it as controlled, because we're still having people test positive, and that's the only way I guess we'll get this under control is when we start to have a number of consecutive 0 days, and hopefully that's not too far away.
Those sites you mentioned that you're still hoping people will come forward, is that because you're worried that not enough people have been tested that have been to those exposure sites? It's
both. It's in terms of the Sky salon hairdressing studio, that we are concerned in relation to, it's a high transmission site that we've been able to see a number of people that have moved through there have tested positive. So it's got a higher level of risk, but the numbers of testing through that site has improved in the last few days, but we really have another call out for people who were there during those dates of the 15th to the 20th of August to come forward and be tested.
Is it still, how many households are we still talking about?
In the order of 35 now, in terms of households that have someone who's tested positive.
And all the cases are still linked?
All still linked. There's one that the contact tracing process is still underway to determine it finally, but that's still work ongoing.
You mentioned that 6 people have been transferred to Melbourne and a number were in Shepparton Hospital. Do you have the final numbers of the events that are hospitalised in Shepparton?
There's three patients in our hospital at the moment with COVID. 4 in fact. One person will be transferred to Melbourne later today, and And there's, as I said before, a small number of people coming in to the emergency department requiring care, but they've either been transferred home or admitted.
And also I wanted to ask about testing numbers. What's our current tally at with tests in Shepparton?
So far since the current outbreak commenced, we've tested over 21,000 people. That's at the sites that GV Health are coordinating and operating. There is other testing sites that service is being provided in the community at the moment, so it would be more than that, and on a rough proportion of the population, that's I think well above 40% of the population of Shepparton and Marupno.
And what's the current wait time for a result at the moment?
Turnaround times for test results at the minute are within or about 24 hours. Earlier last week it was a little bit higher than that in some occasions, but generally people are getting their results within 24 hours of the test being taken.
Good afternoon, everyone. Since the 22nd of August, organisations, community, agencies, departments have managed to deliver over 3,000 care and relief packages to households in the Shepparton area. This care and relief has included specialist needs such as medical, baby formula, other personal cultural needs. It's been an enormous effort, and it could not have been done without the wonderful efforts of local government in coordinating, the combined and collaborative efforts of agencies and departments, volunteers, community, and what has been a mammoth effort of all who have been involved in this relief. It's been actually quite amazing to watch and see, and it goes really to the heart, I think, of what a resilient community looks like. Similarly, the food and grocery sector has stepped up, and they have adjusted their service offerings and made sure that they've worked hard again to meet the needs of a local community that's been in stress. They've adjusted things such as online, brought in workforces, and made sure that the needs of Shepparton have been met as well as they can, at the same time that they've been experiencing significant workforce shortages and challenges. The other thing I would like to talk about today is the agricultural sector. And Agricultural Victoria has been focused very heavily on providing support to farmers within the region. This includes veterinary services, stock feed, and other needs that farmers have required. And I know they've been ably assisted by the Farmers Federation and others, all involved in that sector. This morning I had the pleasure of meeting with a local businessman who's well known in the Shepparton area. His name's Azim. He manages a business called, let me get this right, Lutfri's Kebabs, and he has provided yesterday 340 meals to homeless people, and today he's expecting to do a further 500 more. I think this is just a small indicative case of what really is a truly supportive, proud and capable and resilient local community of Shepparton. It's, as I said, unless you have that type of spirit within a community, meeting challenges that we've had over the last 10 days could not have been achieved. And I think Shepparton really needs to congratulate itself, and as people are moving towards those day 13 testing, and as a little bit more stability comes back into the city, can I only just say, please don't become complacent, because as Matt said, it's a terrible virus, and it's one that can produce such devastation. In order to maintain and keep on top of this as best we can in such challenging times, we really do have to keep it full in front of focus and make sure that we support and work really closely together. Otherwise, it's the challenges that we've faced previously, we won't learn from them. So again, thanks Shepparton. You're absolutely amazing. Thank you. Any questions?
What are your discussions with the government about shutting down Shepparton and opening up the rest of regional Victoria? Are you speaking to the government about those ideas?
Could you explain what you mean by shutting down Shepparton?
Yeah, they said they're going to shut down the potential for Shepparton's local government area to be blocked off to the rest of regional Victoria, and regional Victoria reopen.
I probably can't answer what is would be discussions I haven't been involved in, and certainly it's probably at policy and government level and for the Department of Health to answer that.
In terms of the response here, how much longer do you think it'll be needed while the community continues to recover at the moment?
What we're seeing at the moment is that demand is being met. So in terms of relief, we're finding the numbers of referrals are starting to decline. There's definitely still that need for specialist services, be they, as I said, your perishable goods and some medical supplies. But again, as people move towards the high days of testing, it may well release significant numbers of people back into the workforce and into normal lockdown conditions. We're also seeing the supermarkets, as I said, being more stable and bringing back some of that essential workforce. This means that larger parts of the community is able to support itself without that urgent relief need. Again, it goes to what is a resilient community, because they are able to then look after themselves more easily. It's not to say that you never disregard what is urgent need, and for those that need it throughout and regardless. And again, that's where local government always works so hard. They actually do this 365 days of the year, supporting those in need and vulnerable communities. And they work with all the local partners that you've seen that have been operating in this combined effort. So it's not that it's not there, it just means that things return to a slightly more stable bit of normality.
How many numbers have we got in town at the moment for ADF and any other support?
At the moment, the ADF footprint is 80 personnel within the Shepparton area, and again they provide a variety of functions. We work closely with ADF to make sure that their effort is well positioned and that we don't duplicate effort where it is we don't have that surge priority need. So again, we work to assess risk, and risk within an emergency is always ebbing and flowing and evolving. So it's something that we have to do consistently to make sure that when we do have that additional support that we're using it wisely and well.